Good morning. On behalf of the NC Chamber, welcome to the NC Chamber's COVID Liability Legislation Update. I am Janelle Boyd with the NC Chamber. All attendees are muted to avoid any distractions during today's presentation. If time permits, we will answer as many questions as possible at the end of the presentation. If you would like to submit a question during the meeting, please do so by using the question and answer box. Please do not use the chat box. You may upvote the questions you most want answered by clicking on the thumbs up for that question. The questions with the most votes will be answered first. Now, I would like to introduce you to today's speaker, Ray Starling, General Counsel and President of the NC Chamber Legal Institute. Ray.
Thank you, Janelle, and thank you for folks joining us. I think you're in for a treat today as we talk about what the General Assembly has done to respond to the liability risks that are associated with COVID-19. The number that I saw last night as I was putting finishing touches on our preparations for today was 3,832 complaints. That's the number of lawsuits that are capable of being tracked across the United States that have been filed and have some connection to COVID-19. That number is more than likely a vast understatement, because in most states, the statute of limitations means that the current figures are really misleadingly low, that there's actually lots of time for more lawsuits to be filed. So thank you for joining us. I think this is an apt topic to be discussing. And in looking at the participants list, we have a very diverse group of folks who have plugged in today to hear what these lawyers plan to share with you about how the General Assembly has reacted to this in North Carolina. In fact, I'd pause on that a minute and say I was interested in seeing that, of course, we had manufacturers and engineers, some of the core members, if you will, of the North Carolina Chamber participating today, but also I saw folks from the travel and tourism industry. I even saw a theater who is concerned about making sure that their business is doing it right in times like this. I saw folks from the nonprofit sector, even some folks in the ministry that are joining in today to hear what it is that this panel has to say. Certainly some medical providers listening in, and we're grateful for that, for what they're doing during this time, but also for them joining us today. But I thought the best commentary on this was there are actually, and I hope they don't mind me mentioning them, there are actually a couple of NASCAR teams listening in to the seminar today, and at least one company that runs a zip line. Now, I think that's remarkable because those two entities, or those three or four, should know a lot about risk and are usually pretty bold in the face of risk. But even they recognize we're in a new era with COVID, and we need to know and take advantage of the protections that the General Assembly have put into place. What we asked for at the North Carolina Chamber, and we certainly did this along with a business coalition, we went downtown and asked for targeted, timely, and temporary protection in the face of what we're dealing with here. The rationale was that the guidelines at the federal and state level for what we are to be doing as business owners continue to shift as we learn more about the virus. We truly are in, quote, unprecedented times with regard to this. And the standards seem to be evolving, which is what they should do as we learn more about the best way to mitigate the impacts. North Carolina, I think, has been a leader, as you'll hear these folks say today, with regard to mitigating liability risk. There are across the country at this moment 14 states that have done something similar to North Carolina. There is no model act. Each state has reacted and acted in its own way. And of course, what we're going to see at the federal level is still very, very much up in the air. So what did our General Assembly do? Our panelists are going to answer that. And before I move to introducing our panelists and giving them time, I would also mention we may actually have a couple of members of the General Assembly listening in today as well. We're grateful for the courage that they took here to enact this legislation, for the communication and the collaboration that we had with them. And we look forward to continuing to work together if we got something that wasn't quite right, or if we need to come back and tweak something. With that said, a lot is said about our General Assembly members, but I think a piece that's frequently not said is that they spend literally hundreds of hours doing public service for really what amounts to nothing in compensation back, and a lot of time away from their families. And so we're grateful for what they did here and the courage they showed by enacting this legislation, but also just the representation that they bring their communities all the time. So our panelists, and behind the panelists is a team you already heard from Janelle, but I also always like to compliment the chamber team, Talisa Height and her colleagues on events, those in marketing, Beth Shore, who's the vice president of our marketing efforts and our member engagement. All of these people work together to see that an event today comes off relatively smoothly. So with that, the first person we're going to hear from is Phyllis Pickett. Phyllis is a staff attorney down at the General Assembly. And what that means is Phyllis actually has 170 bosses. She is a member of what we call the central staff down at the General Assembly, meaning she's a career staffer. Unlike in Washington, D.C. or at the federal level, the North Carolina General Assembly staff generally don't come and go when there's a change in the political leadership. And I will tell you, having been a part of both systems, I like what we have in North Carolina because it means we have state treasurers like Phyllis Pickett who have a tremendous amount of institutional knowledge and legal acumen at our disposal as taxpayers. She's seen a lot. She's a UNC law alum, but she has been down at the General Assembly for 29 years. Prior to that, she practiced with legal aid out in Eastern North Carolina, and I believe even has Eastern North Carolina roots, which is why Phyllis and I can have an entire conversation and no one else understand what we're saying. But she's been recognized by the Wake County Bar, by the North Carolina Bar, and even by the American Bar Associations for her professionalism, her commitment to diversity, her interest in mentoring, raising up young lawyers as well. At the General Assembly, she has to know a lot about a lot. Sometimes we as litigators and attorneys, we like to kind of look at what the General Assembly wrote and we say, oh, well, this was just, really bad drafting. What we don't sometimes recognize is that that language might have been drafted while the staffer was sitting on one knee with their laptop on the other knee on the floor of the General Assembly right before the bill was to be considered. And so Phyllis is one of those staffers that makes that place down there work. And she's going to bring an interesting perspective this morning about how this really got done. And at the end of the day, what did get done. After her, we will hear from David Sousa. David will talk somewhat specifically about the protections for those in the healthcare sector, which is where his career has now most recently been focused. We all owe this group of professionals in the healthcare world a great debt of gratitude, and a debt of gratitude that's going to continue, I'm afraid, for several months, if not years. But David is a part of that industry that supports and serves those who have served us most during the pandemic, and that is the healthcare sector. His employer, Curi, where he's the COO and the general counsel, they provide insurance products to medical professionals up and down the East Coast and around the country. He practiced in a private law firm before going in-house at Curi. A Wake Forest alum in terms of law school, undergrad at University of Kentucky. But most important to me, David is one of my bosses. He's actually the incoming chair of the Chamber Legal Institute. After David, Chris Smith of the Smith Anderson Law Firm will come on to talk more about the specifics of the non-medical pieces of the liability protection. He is the co-chair of Smith Anderson's litigation team. He's on the board of directors here at the Chamber, the executive committee at the Chamber, and he is the immediate past chair of our Chamber Legal Institute board, and has also served as president of the Defense Attorneys Association. Has a lot of legal acumen, has been in the courtroom, has an amazing pen and penmanship when it comes to writing briefs. And probably the best compliment I could give Chris Smith on here this morning is he is a practitioner that balances pure litigation strategy and tactics along with an awareness of the policy atmosphere that's in play, quite frankly, better than almost any attorney that I've had the pleasure to work with through the years. So you're really in for a treat, starting with Phyllis. And so Phyllis, if you don't mind, set the stage for us. Talk to us a little bit about what the General Assembly was thinking and doing here, and at the end of the day, what got put on paper and what got passed into law.
Thank you so much, Ray, for that introduction. And I'm happy to participate today to discuss how North Carolina lawmakers aligned against COVID-19. You know, our state motto is esse quam videre, to be rather than to see. A Cicero quote, but it really speaks well of exactly what happened starting in March of 2020 entire world became aware of the significance of the COVID-19 pandemic. Next slide, please. So the 2020 regular session, slated to begin on April 28, 2020. What happened before April 28, 2020? Well, by March of 2020, the World Health Organization had declared a pandemic connected to the novel coronavirus. Governor Cooper issued an executive order number 116, declaring a state of emergency in March. And President Trump declared a national emergency. North Carolina General Assembly was slated to come back in April. And immediately, staff and members started working on COVID-19 related issues. Both chambers, all staff, all hands on deck. To be honest, I remember quite well how the Legislative Services Office made such preparations for staff and others to be safe, as we really did a momentous effort to get things started so we could help our members get the job done in time for April 28th. March was an exceedingly busy month at the General Assembly. And consider this, temperatures were taken at the front door, masks were available, people had to take social distancing precautions. The very thing that the General Assembly is really based on, discussion, review of ideas, meetings, became the very things that were very difficult to do safely. Personally, I have come to enjoy a remote meeting, but I did not enjoy them at all in March because it made everyone's job harder. And by April, we were all pretty good at it. So when session opened up on the 28th, the members of the General Assembly had several pieces of legislation lined up and ready to roll. Members put in bill requests as usual. I'm on the bill drafting staff. Folks worked very hard. And in the end, there were many pieces of legislation filed. However, remember this was a novel context and there were novel challenges faced by the General Assembly at this time. Next slide, please. So what happened? The House introduced, by my count, and I could be wrong, 200 pieces of legislation in the short session that started in April and wrapped up in July to reconvene in September and then to finally adjourn sine die on September 3rd, 2020. There are pieces of legislation the Chamber was interested in talking about, and I'm so glad I was invited to be here because as a bill drafter, part of my job is not only to do as I am instructed by members and to rely on the law and our training and our communication skills to help craft legislation for members that expresses what they want to do. Part of my job is also to understand how laws are interpreted by others. And so this opportunity to be here today is particularly meaningful for me on the front end of things. But there were several bills addressing liability during the session. I counted 6 major bills. The Senate bill that a lot of you are very interested in today and the House bill that a lot of you are interested in today, I won't go into a lot of detail about. But I want to make you aware that there was a House Bill 1043, which was the COVID Recovery Act, which actually allocated millions and millions of dollars in relief aid from the CARES Act. Huge, comprehensive piece of legislation. General Assembly passed it on May the 2nd. Governor signed it on May the 4th. There was House Bill 118, as you all know, is the community safe harbor. The COVID safe harbor from immunity. And then there's House Bill 902, which was a liability protection for swimming pools, which in my neighborhood was a big deal. Next slide, please. On the Senate side, by my count, 166 bills were filed in the short session of 2020, including Senate Bill 704, the COVID-19 Recovery Act, a major policy bill that matched the money bill I mentioned earlier, as well as Senate Bill 208, which is the COVID liability protection immunity for higher education. And then there's Senate Bill 113, which was immunity for non-public schools for claims related to COVID-19 closures. These bills All were significant. In my areas that I draft, the civil procedure and evidence, it will be interesting to see how the courts may interpret some of these. But I will tell you that they were done at a time that the General Assembly pulled together under many novel circumstances, proxy voting, social distancing, everything that was done to move so quickly that these bills were filed and in place. And I wait now to hear what the two esteemed lawyers after me have to say about a couple of them. Thank you again, Ray, for the opportunity to be here.
Phyllis, thank you for being here, and your commentary, having been inside the building down there, is very valuable. And don't let Phyllis fool you. She set the table, but she's going to have some thoughts and opinions about these that she'll share toward the end. And Phyllis, I have to smile. I see your office light. One of the things I remember about the General Assembly is if you sit very still, the light will go off in the room. So you keep moving around over there, and we're going to transition to Chris Smith. I apologize. We're going to transition to David Sousa. And David is going to go back into some of this legislation that focused around the healthcare community and unpack that a little bit and talk a little bit more about those details. David, thank you for being here, and we look forward to your analysis.
Thank you, Ray, and thank you, Phyllis, for your remarks. Thank you for all you did to help so many people with the legislation that you just reviewed. If you all think back, the last week in February and then the beginning of March, all eyes in this country were either focused outside of the borders of the U.S., perhaps to where the virus began and then spread. But more importantly, within the United States, we looked to the West Coast, primarily Washington State, and then we looked at New York, and specifically New York City. And we all remember, and there will be books written about this, there's already been so many articles that you can't count them, that what New York City experienced was unlike anything that this country has ever experienced in modern times. The demands that were placed upon the healthcare delivery system in New York City were just ridiculous. And you can see from the bullets there that what we very quickly learned is that we are geared up in this country to deliver normal healthcare under normal circumstances. And for reasons totally out of the control of everyone, when those circumstances change, everything changes. And we were very concerned within the network of people that focus on healthcare issues in North Carolina, that it was entirely possible that what we were seeing in New York City could come to North Carolina. So one of the things that we realized immediately was that if we are going to rely upon healthcare heroes to protect us in North Carolina, as the hospitals and the doctors and the long-term care facilities were doing in the state of New York, we needed to protect those healthcare heroes. Governor Cuomo in New York, very early in the declared state of a pandemic there and a declared state of an emergency, entered multiple executive orders that were designed to protect healthcare providers so that they would continue to put their own lives on the line every day and those of their families and friends that they came in close contact with after they left their care facility, and make sure that those people would be protected. Next slide. We knew that in order to make the case, both before Governor Cooper and the prospect of getting executive orders entered, similar to those that Governor Cuomo had entered in New York that protected the healthcare community, or to get a bill passed or multiple bills passed before our General Assembly, that we didn't need just anecdotal information, we needed data. So very quickly, there was a collaborative effort that was focused on the physician practices throughout North Carolina. It was a joint effort between our company, the North Carolina Medical Group Managers Association, and the North Carolina Medical Society. And we began doing weekly surveys that tracked accumulated and reported back on not only data, but trends in the data that we were seeing bubble up from as many physician practices who we could reach in that state. That survey began the last week in March, and it has continued every single week since then. In addition to the data that was being compiled from the physician practices, the North Carolina Hospital Association, and the hospitals around the state, the North Carolina Department of Health and Human Services, thank you, Dr. Mandy Cohen and her staff, and the North Carolina Long-Term Care Facility Association. We're all compiling data. What has changed in the delivery of healthcare as a result of the pandemic? Next slide. Quick peek into some of the data that we are tracking on the physician side. This was a cut of data that just happened to be from the week of April 27th. It was one of the data slices that I pulled for the slides. This one focused on the negative impact on physician practice revenue across the state of North Carolina from the commencement of the pandemic running through that week, being the week of April 27th. We also tapped in as to not to acquire knowledge as to whether the practices had participated in any of the protection program dollars that were available. The data became extraordinarily helpful when the governor's office and the General Assembly really asked incredibly good, thoughtful questions about help me understand how the practice of medicine, how the delivery of healthcare is being impacted in the state. If you're going to be asking us to grant immunity to those healthcare providers, you've got to convince us that this is not a state of normalcy. So the data became critical. Next slide. We formed a coalition within the healthcare market sector among all businesses in the state within 10 days after Governor Cooper declared his state of emergency in North Carolina. We put together people from hospitals, long-term care associations, outside counsel, our company. We met regularly by email, by Teams meetings, Zoom meetings, and the singular focus was if we are going to continue to ask all healthcare deliverers, facilities, individuals to provide care and to put their lives at risk while they're providing that care, can we get them immunity that covers them, as Ray stated at the outset, only during the declared state of an emergency? And how quickly could we get that in place so as to reassure these people, don't shut down, even though your practices may be, don't shut down, even though the hospitals were getting crushed from a revenue standpoint because people just didn't want to show up to have elective procedures performed. Don't shut down when the state's citizens need you the most. First route that we took was trying to get executive orders entered through Governor Cooper's office. We had to help the governor's office understand why legally we felt that he had the power to enter orders similar to what were already being entered after New York entered the first in other states around the country to protect healthcare providers. When we began to sense some reluctance for reasons that we understood from the governor's office to be able to enter an executive order granting immunity to healthcare providers, we then turned our attention very quickly to the North Carolina General Assembly, and we worked tirelessly with the General Assembly in trying to come up with language that could protect healthcare providers, but also be fair to the citizens of the state. That process at the General Assembly went at warp speed. And within just a few weeks, we went from having no proposed legislation to Senate Bill 704 passing by a vote of 46-0 in the Senate and 119-0 in the House. I can tell you, for those of you that pay any attention to what happens in any legislature anywhere in the country, that to get that type of universal bipartisan support of any bill, let alone one that arguably takes away the right for a limited period of time for somebody to sue healthcare providers, you just don't see that kind of support very frequently, if at all. So Phyllis and her team just gets huge props for working with us and trying to get that done. And then on May 4th, Governor Cooper entered the bill and enacted it into law. Last slide, or actually next, I'm sorry, there's one more. So here's what we got. And this is unprecedented in the state of North Carolina, because what it says is the legislature and the governor agreed to rewrite an existing general statute in North Carolina that pertained normally to an ability of a patient to sue for medical malpractice. And it said that for all healthcare providers in all healthcare facilities, if you're rendering any care to any patient during the pandemic for anything, we're going to protect you. The only way that you're going to be sued is if you engage in acts of what we'll call, and what the law calls, gross negligence or intentional acts, a very much higher standard than typically would apply. Next slide. And then finally, we wanted to be sure that all healthcare providers and facilities were reassured that if their own employees came back to work, and as patients began to come into those facilities, that they could not sue the facilities merely because there was a transmission of the COVID virus from somebody within that facility to the patient coming there for treatment, including the workers themselves. So we didn't want to open a Pandora's box of a nurse, for example, in a medical practice who contracted the virus, turning around and suing the practice who was his or her employer simply because they contracted the virus. And on both counts, the contraction of virus when you're a worker in a facility delivering healthcare, and then broader for all healthcare providers for anything that might be an untoward result during the emergency, they cannot be sued. I think that's it, Ray, from me for now.
Yeah, thank you, David. And I think David does a nice job talking just about even the behind the scenes, what had to happen here, some of the give and take that resulted in this. But part of David's focus here was to talk about the healthcare community and the protections the General Assembly has established there, mostly through Senate 704. But Chris, there were protections in 704 that also helped the greater business community. And then there was a second bite at the apple in House 118 that I think even expanded that protection even more. So tell us, outside the healthcare sector, what got accomplished and your analysis and some of your commentary on that.
Please do, Ray. Thanks, Ray. Thanks, David and Phyllis. If we could go to that first slide, great. So House Bill 118, what David was talking with y'all about was the healthcare aspects of Senate Bill 704. And like Senate Bill 704, House 118 passed nearly unanimously. I think the Senate was 40-6, and the House ended up being 109-6. So by tremendous margins. And David, in his discussion of the protection for healthcare facilities and for healthcare providers, they really nailed it in Senate Bill 704. They hit the nail on the head, got exactly what healthcare heroes need in order to be able to take care of our communities and be treated fairly in doing so. Senate Bill 704 had two other components, and those were addressed to business issues. And the two other components are listed at the bottom of your slide here. They also, 704 also addressed emergency response entities and essential businesses. Emergency response entities being things like, LabCorp doing testing for COVID-19, or a great example, Hanes in Forsyth County, Hanes Brands in Forsyth County, pivoting many of its production lines from clothing to crank out masks for all of us, things that we all need and we want to have happen, but these folks need the protection to know that they'll be treated fairly. Senate Bill 704 did that for emergency response entities. But the other component was essential businesses. And essential businesses got a similar protection that they'd be protected from COVID-19 infections, or transmission claims, except in moments of gross negligence. But essential business, and this was a good example of inter-branch cooperation between the General Assembly and the governor, where the General Assembly essentially delegated to the governor the authority to define what an essential business is. Now, 704 had passed May 2nd, and the governor had previously issued, everyone will remember, the first stay-at-home executive order. That was number 121 back in March. And that defined a significant swath of the economy as essential businesses. But there was a very large aspect of the economy left out altogether. So we moved forward from 704 to the time of 118, House Bill 118, which is late June, early July. And there's the emphasis on, we've both, Ray made mention of changing standards, and we're realizing, my goodness, we have to keep each other safe, but we also need to keep the engine of the economy working. And so there were concerns about that large swath of the economy left out of the definition of essential business. And then also, even within those businesses defined as essential in the executive order, there were concerns there. One example, and I'm reading now from the governor's executive order 121, done quickly in March, in good faith, people working hard trying to get it right. But this is a moving target that we all know. And so what they said at the time, here's one significant part of our economy, educational institutions. And at section 17 of his order, the governor says, educational institutions, including public and private, pre-K to 12, schools, colleges, and universities. That's good so far. We all understand that. They're important. We need to protect them, give them space to operate. But then the order says, for purposes of facilitating remote learning, performing critical research, or performing essential functions. Little ambiguity, not perfectly clear there, caused concerns. Further, that provision states, provided that the social distancing requirements set forth below in this order are maintained to the greatest extent possible. So the lawyers on this call all get how, gosh, to the greatest extent possible and for the purpose, and your immunity is tied to that. I'm not so comfortable with that. So there was a broad coalition that came back to the General Assembly saying, look, things have changed. We've got to keep the engine of the economy going. And we need to be sure that we're treated fairly in doing that. 118, House Bill 118 did that in really two broad, simple, and elegant in their simplicity strokes. The first is up here now in front of you, and that's the definition of person. And a person, you'll see, is very broadly defined. Any individual. And for the nonprofits on there, you can rest assured you're specifically mentioned as well. But any individual, that's you, me, David, Phyllis, even Ray, and everybody on this call. you're within the definition of this legislation and any other legal entity. So every legal business entity in North Carolina, essentially everything except dogs and cats, is within the definition of person on this slide. So that's stroke number one. Next slide, please. So what do you get? What is your liability shield? What's the protection? And this really is the meat of the coconut here. Section A, in any claim for relief arising from any act or omission alleged to have resulted in the contraction of COVID-19, jump forward, no person, that's everybody except dogs and cats, shall be liable for any act or omission that does not amount to gross negligence. So those are the broad, elegant, really elegant in their simplicity strokes to make sure that, to keep the engines of the economy running and ensure that we're all taking care of each other. That's how 118 did it in near unanimous fashion. Now, what does this all mean? The business community is going to need to keep careful watch of the picket fence and how it's constructed right here between gross negligence and what's not. This really is the meat of the coconut, and Phyllis asking, how's this going to play out? I really want to know, see what the lawyers do with the language. Well, gross negligence, and here's the lawyer language in the books, the wanton conduct done with conscious or reckless disregard for the rights and safety of others. Well, what is that? That's common sense. Let's dumb that down. What that means is if you're somebody who you think you might have the bug or you've got it and you go to work, no, you should never be protected for that kind of conduct. You're an employer and you've got questions about the health of your workforce, no, they don't come into work. You don't get protection. In plain English, it's mistakes, and even some bad mistakes would be protected. But if you make a really bad mistake, you're not protected. Next slide, please. Okay, final slide before I flip this back to Ray, and y'all need to pay close attention here because what comes next is, Ray says it's a poll, but it's actually a quiz. You're going to be quizzed on this provision. And this is an important part of 118. And what it says is, every person shall provide, with respect to any premises owned by the person or under the person's possession, custody, or control. And don't worry, it doesn't mean your household or your personal property. That's accepted from this notice requirement. But every employer, Curi, the chamber, my law firm, Smith Anderson, all the companies on this call, you have to put up reasonable notice of actions taken by, that's the operative language, actions taken by the person, again, everybody except dogs and cats, for the purpose of reducing the risk of transmission of COVID-19. Now, an important point about this is this provision is not linked to your liability shield. If you mess this up, you still have your liability shield. If you fail to do it, you still have your liability shield. You must do it. It's what the law requires and what you're supposed to do and what everyone needs to do. And you can see why the legislature saw fit not to link that notice requirement to the liability shield because we've got tens of thousands of businesses. Reasonable notice, what's that? Are we going to litigate over proper notice before giving someone the protection that we intend for 118 to give them? So with that, I'll pause and flip it back to Ray for his first quiz.
Well, thank you, Chris. And we were treading in deep water there. Chris did a nice job walking us through the particulars of the legislation. And I think one thing we'll circle back to in Q&A time is, we can see on the screen what it says. We can talk about what it means, but for business owners, what does it mean for me? What do I have to do? What am I protected from? And so I want to dive into that a little bit in our conversation here. I also want to remind participants there's a Q&A button down at the bottom of your screen. And if you have a specific question you want to pose to this panel, and let me just pause to say, if we were paying these folks by the hour, this would be a very expensive presentation. But you get a chance to, for free, to pose a question to some of the sharpest minds that have analyzed this legislation in the state. So put that question in the Q&A box. We'll take a look at it, and remind you also you can upvote a question by liking it and move it to the top of the queue. But I'm going to start where Chris finished, and that is he talked about this notice requirement in House Bill 118. This notion that businesses now have a mandate, not an opportunity, not an option, not an it would be smart or wise to do it. But state law now says if you have a business that's open to the public, you have to provide the public with some sort of notice of what you've done to mitigate the risk of COVID transmission. So we went out this week and we actually have a visual of a sign that we saw on a small business door. I don't think the business that I'm dealing with here is a chamber member. It's actually my shade tree mechanic. But Ray Weatherspoon does a nice job working on old vehicles, which is all that I own. So on his front door, when I dropped my car off on Sunday afternoon and he worked on it Monday, I took a quick picture of this notice. And it, you know, I'm not going to insult your intelligence by reading it to you, but the question is it adequate to comply with the provision in House Bill 118 that requires a business owner to inform the public of what they're doing to mitigate risk? So take a moment to look at it. And then we've got a poll. I would also tell you that that poll screen that just popped up, you can actually click on it and move it out of the way if it's in the way of the notice. But is this notice adequate? If you're a business owner and you copied this form and you put it on your door, would that be adequate to comply with the mandate in House Bill 118? We'll give you about 5 or 6 seconds to respond to that. And I'm being told, panelists, that hosts and panelists cannot vote. I do not think that's fair. But look, so this is going to be an interesting conversation because 90% of our participants, 45 out of the 50 that took the poll, believe that this is adequate under House Bill 118. A few think it's not. So panel, what do you think? Does this comply with the provisions of House Bill 118? Is this enough to comply with 118? Who wants to go first? Phyllis, you're on mute, so you may want to unmute yourself if you're going to hop in. David, what do you think?
I don't like the fact that there is no mention of wearing a mask. And right now, with the current direction that we are getting both from the governor's office and from the Department of Health and Human Services, I think not at least making that request and saying that we inside the door are wearing a mask is a potential problem.
Good comment. Nothing there about the mask.
Yeah, and Phyllis, did you want to make a comment? I've got.
Go ahead, Chris. Go ahead.
So I agree with David that this is not ideal. I would also say that Ray's poor shade tree mechanic doesn't have the benefit of David's fine legal mind, nor do most people in the state. And so I view this, I think it's interesting that the General Assembly did not link it to the liability. And I think this is kind of a good example of maybe why that's so, because we've got tens of thousands of small businesses that they don't have epidemiologists on staff, they don't have doctors on staff, and they're trying to act reasonably. And I think Ray's mechanic here has taken a shot at acting reasonably.
Phyllis, you want to weigh in?
What I would add to that analysis is that if you are the customer, you walk up to the door and you read that sign, you are getting notice of what's being done. And to David's point, they may not be wearing masks inside. You may know that now. And part of the difficulty involving negligence is you have elements of negligence, and this notice provision really goes to what can people do to keep themselves safe? Well, if you know what it is, if the standard is to put this notice here, maybe this business owner has met that standard.
Well,
The
and
person coming to the business knows what is and is not claimed to be done.
that's
And
right.
that
I mean,
is, I think, part of what the law is supposed to do.
that's right. I mean, I heard the phrase a couple of times, assumption of risk. You have to understand what the business owner is doing before you decide to go in there. And so this is a way to be informed about that. One of our questions in the question box was, is there a standard notice? And I know, David, that's a question you and I have thought about as we try to help chamber members and as you try to help folks who work with Curi. There is no standard notice, is there? What are your reflections on that, David?
There's not, and I think that that's intentional, Ray. I think there was a recognition that every business is going to have somewhat of unique circumstances within their four walls or outside of it, and that every business needs to make adjustments to act reasonably, taking into account their own unique circumstances. So, for example, Ray's mechanic, the only encounter that you may have in bringing your car in for service may be when you walk in the door and hand them the keys, and maybe you've already told them over the phone exactly what it is that you need done. That is a really different encounter circumstance than if you wanted to walk into a restaurant and be seated for an hour or two. And there are, countless number of other people, employees, and patrons who are there. I think that the two different businesses in my example would have to take different measures from each other.
Well, that sort of sets us up, I think, David, because we're going to look at a different business, one that Chris, no pun intended, stumbles into over in Chapel Hill. You want to tell us about this one, Chris?
No pun intended, right? These are the signs at the front of, it's called Bottle Rev, which is a great wine and beer vendor in East 54 in Chapel Hill. And I'm a customer. I'm a more frequent customer now during the pandemic, but so here's what they've posted. And I think comically, they've got the poor fellow in the skeleton. They call him Norm, Chief of Safety Office for Bottle Rev, Chapel Hill. And you see what they say. They've got the 3 W's posted there. They've got a stop. You can't come in, no mask, no enter, and you can go across the street and buy one at the Walgreens. And so the question for y'all is this adequate notice as required by H118?
David, while folks are voting, I know that you mentioned the sausage making process. I prefer to refer to the legislative process as making wine.
All right. Wow.
Yep.
A little closer vote here, Chris. So what's your verdict, Chris? What do you think?
Well, so, folks were listening closely, I think, when we talked about the notice provision, which says reasonable notice of actions taken by the person to reduce. And you've got your 3 W's posted there, but it doesn't say we do this, we require this. I think that's some careful lawyering there, and that's what we all do. And I think my friends at Bottle Rev would satisfy the technical requirements of the statute if atop Dr. Mandy Cohen's Department of Health and Human Services wrote at the top there, you are required to, and we also ourselves know the 3 W's and practice the 3 W's. You do something, I think, as simple as that, and you're doing reasonable notice of being a good citizen. But I think there's a technical fault here from my friends at Bottle Rev.
Any more thoughts on that, Phyllis or David?
Once again, I would say, what does it tell the person going into this business? It doesn't answer what's going to happen on the inside when you get in there. And I do agree that there's no one size fit all for the notices. It's going to have to be the reasonable, prudent person draft that notice, put it in the window or on the door to comply with the law.
Well, and one of the questions in the Q&A box kind of teased this up, so I'll shift to that for a moment, but it's still on this topic of notice and what's sufficient. One question was, should the notice be posted, or is it sufficient to send the notice to all employees? And I think for a public-facing business, there's a pretty clear right and wrong answer on that one. Any thoughts from the panel on it?
Posted.
Posted versus just sending it internally.
Yeah, I agree with that totally. I think we've got to, we're going to be walking around as H118 takes hold. We're going to see a lot more of Norm, Chief Safety Officer, that sort of thing in people's doorways and windows, as there should be.
Ray, I noticed that there are other questions on this same issue, and they're all great. One of which is who ultimately is going to be the determiner of whether notice is sufficient or not. And as Phyllis and Chris both alluded to in their comments, we've got a lot of unanswered questions. And if misery loves company, we've got a ton, because every state in the country has the same questions within their business community, because there is virtually no legislation anywhere in the US to date that provides any more detail around the notice requirements than that which you see in the legislation that was passed here in North Carolina. So unfortunately, it's going to be up to the plaintiff's lawyers, if they feel that they've got a good opportunity to pursue a claim, to try and argue that the notice, whatever it was not adequate to satisfy the statutory requirements.
Well, and I think, David, I thought this is where you were going to start with it. Our presentation today, it's not just about the notice piece. The notice piece is now a statewide mandate. But I think the important takeaway here is you can set that piece to the side. I mean, responsible members of the business community ought to try to comply with that, and any liability arising from not doing that may be a separate question. But in terms of COVID transmission, I think one question is, how bad do you have to be as a business to lose the protections that you had in Senate 704 and House 118? Can you talk about that a little bit? If I am doing the 3 W's, if I'm encouraging my employees to do that, if I have some signage up, I'm worried in a litigious society that we live in, David, I'm worried I'm still going to be approached with that, plaintiff's lawyer you talked about. So how bad do I have to be doing to lose what the General Assembly put in place here?
I'm not sure it's how bad a given business has to be doing as much as it is comparing what that business did to what similar other businesses did do. I know at our company, because we have to defend doctors if they're sued, we have been creating an electronic library, if you will, of every article that has been published anywhere that we've been able to find since the declaration of the emergency in every state, that chronicles the problems that not only healthcare providers, but most businesses are having in adjusting to these ambiguities. Because the best evidence, if you get in front of the jury, is going to be putting in front of that jury, look, here's 5,200 articles that talked about the difficulty that these businesses are having. Think about Walmart last week, where they initially indicated that they were going to require masks, but then for fear that their employees might get victimized by somebody that didn't like them being told that they needed to wear masks, they decided that they weren't going to enforce their own mandate. And I think that the more businesses that have reacted similarly, the more likely that their conduct would be deemed to be reasonable, whether it be the notice requirement or any other conduct that they try to undertake.
Let me keep pressing through a few of these questions here, because we've only got a couple of minutes left. Again, I think we covered that topic, that there is no form There is nothing we can go download and check boxes because it's meant to be specific to each business. What is your business doing in your context? And David, I think the reasonableness analysis, that's where that resides, similarly situated businesses. I would also comment, there's a lot of questions about the federal government piece. Based on media reports we're seeing out of Washington as recently as this morning, that looks very distant. We will watch that as the chamber, and we will make sure we update you. We certainly support some sort of federal response, and the U.S. Chamber is very engaged in that. I wonder, Chris, it looks like you have a comment. Go ahead.
Well, I was just going to mention, I think David's comment, I agree entirely with it. And I think it points up the wisdom of what the General Assembly did in not linking the liability shield to the posting of adequate notice, because it's just the liability shield, you have it, but you have a separate duty to post reasonable notice. And David's comments point up how that, what's reasonable. It's an evolving standard. We're figuring it out as we move through. And for 118 to do what folks wanted it to do, it wouldn't have been able to do that if it had been contingent on reasonable notice. And, David's comments just kind of highlight how we're working our way through that.
Well, Phyllis, I'm coming to you with this one. There's a pretty specific question on here from a gentleman who's involved in the transportation sector and the logistics world. And the question very specifically is, under any of this legislation, do I need to be asking my employees every day, do you have a fever? Do you have a cough? Does anyone in your household been confirmed COVID positive? Do you not feel well? Does this legislation mandate that an employer do that? In other words, do you miss out on these liability protections if you're a business that happens to not be doing that sort of onboarding interview with your employees every morning?
Well, one thing about the protection that was afforded, there is no immunity as to workers' compensation claims. So those
very
are
good point.
I think that individual might want to seek some counsel on how best to operate. But in this sort of context, the more information may be better than having less. But I can't really speak on what might be best in that case. However, workers' comp claims are excluded.
That's a great
I also want to just comment just for a moment that these standards that we have in these two statutes, they will not last forever. They are both time limited.
That's right.
Under Senate Bill 704, the immunity only applies to claims filed on or after March 27th. And it is going to cover acts and omissions until the emergency declaration is rescinded or expired. In House Bill 118, claims that arise no later than 180 days after the expiration of the emergency order are covered. So as we talk about timing and the novel situation of the General Assembly, the governor, the whole state and country and the world, these are still evolving standards and evolving issues. But at some point, these may need to be addressed again, or maybe not. That's a decision for the General Assembly to make. But I do think it's interesting that these immunities don't keep people from going to court, but it provides protection for defendants when plaintiffs do go. And that protection would appear to be based upon the standards and evolving standards and the fact that these expire, also indicates General Assembly's attention that they're not permanent at this time. And if you think about the evolving nature of knowledge about COVID-19, that might make a lot of sense.
Yeah.
Curious
Well,
about any thoughts on that from either Chris or David.
Well, let me just kind of turn it over to our panelists. Closing thoughts. We're going to run out of time. I know, Chris, you're at a private law firm. You certainly invite people to reach out to you if they have questions. Here at the chamber, we do the same, and we cannot serve as your confidential counsel or anything of that nature, but happy to chat with you about getting the help you need and making sure you have the answers. I know we didn't get to all the questions, but Phyllis, let me, we'll kind of wrap up with you, but let me go to David and then Chris and then Phyllis and put a point on the end of this. What's the last bit of advice you would share based on what we've heard?
From me, Ray, we have learned hugely that we need to engage early and remain engaged. As Phyllis just said, this is a moving target. We've got, 120 participants on the call today, and they probably come from 50 or more different market sectors. I would encourage similar businesses within different market sectors to get together and discuss matters and issues that are common to them. And if they need help working through those, funnel back through the chamber.
Hear, hear.
So David is always thinking about how to manage the big problem, and that I completely underscore that. And another big issue that everyone's got to keep their eye on is this picket fence of what gross negligence is, and that's where the rubber's going to meet the road. And I'll just say a special shout out to Phyllis and her colleagues, because Ray told us that y'all are referred to as the professional staff at the General Assembly, and working with you to get ready for this, I understand why that's so. And you're part of the glue that's going to help us figure our way through this. So thank you.
Thank you, Chris. Phyllis, and let me just say, we're sort of running out of time, but stay with us just a moment. I have an announcement at the end I want everybody to hear. Phyllis, go ahead.
I would just add that the General Assembly is a problem-solving institution, and COVID-19 is a worldwide novel problem. And I'm thankful for the opportunity to be here and to learn from the panelists what they think about recent legislation.
We're probably going to need you back at some point, Phyllis, to tell us about what they do next, because I suspect we're not at the end of this. Folks, you will get, as you log off, you'll get an invitation to participate in a survey. That is very helpful to us. It should only take you a minute or two to complete. Please take that survey and give us some feedback on today's presentation. And again, my gratitude to Phyllis and the state of North Carolina for loaning you to us, for the former chair of our Chamber Legal Institute, Chris Smith, and his firm's expertise in the materials that they even provided in our solicitations and in our marketing. Those are still there for people's benefit. And then, of course, David, now our chairman of the Chamber Legal Institute, who's really charged with leading his peers in terms of thinking about how we as a business community approach liability issues globally and how we position our businesses to navigate them in a fair and just way. Great to have you on the call. Thanks a ton for being here. I'll yield back to the event managers, and please reach out to us at the Chamber if we can be supportive or helpful.